Yay, hi everyone. I can see that you're all here. Just waiting a few more minutes and then we'll get started. Hi there.
Hey.
We have one question already. No, Kathy, I can't hear you. I think. Okay, let's see. Okay, Kathy, you should be able to say hi now. I just guess you're on mute though. Let's see.
Okay, now can you hear me?
I can hear you, yes.
Okay. Am I on video or just my name?
Just your name.
Okay, so let me see if I can. I'm still new to the stuff, so let me see if I can put a picture on.
Think too with webinar, maybe it's just we'll see your name and then.
Okay.
Okay.
Is that okay? Do I have to have a picture? Or am I okay with just a name?
Yep, you're okay for this. Yeah, since it's just a webinar, we'll just have our panelist speaking.
Great.
And then if you have questions, you can put them in the Q&A box or in the chat box.
Okay, great.
All right, good to see you on here. Well, to hear you on here.
Yeah.
All right. Welcome, everyone. So excited to see all of you. So every Friday, we are offering these virtual fireside chats with leaders across different industries on different topics. We really just want to be a service to all of our leaders who are across the city of Long Beach serving in different capacities. And we want to just give you time to pause and think about your own leadership and your own growth and equip you with tools, because we know that leaders really spend so much time focusing on serving others. And we want to make sure that you are able to take care of yourself during this time and continue learning and growing. And that's the beautiful thing about Leadership Long Beach, is we create that space to connect leaders and to make sure they're super informed so that they can be activated to go out and do things in this world. I have my little fireside right here, and I hope you guys each have something to keep you warm. And one thing that's unique about Leadership Long Beach is we start out our programs at the mountain and we sit around. I haven't actually been there yet since I'm new to Leadership Long Beach, but they sit around the fire and they connect and they go deep and they really address some of the inner work that you have to do as a leader before you can come back down the mountain and lead others through the hard times. So we're so glad to see so many leaders that have joined us today. Just so that Natasha has a little bit of an idea of who's in the room, we're going to do a quick poll. So if you could, I'm going to pull up the poll right now. Can you guys all see it? If you can tell us which sector that you're leading in across the city, just let us know which sector are you in? Are you in the public sector, the private sector, or the nonprofit sector? So one thing that's pretty unique about Leadership Long Beach is we create cohorts of people who are in these different sectors. We really believe in order to create solutions for some of the city's toughest problems, you have to have interdisciplinary minds. So we bring together a very diverse group in every sense of the word. And so I'm going to give everyone a few more minutes. We have 20 people who've answered. There's 10 more of you if you want to answer this, and I'll go ahead and publish as soon as we hear from a few more people, just so we know who is in the room. Thank you so much for your leadership across the city during this time. And we know that it's a very difficult time, and we're glad that you paused to just learn some new tools and get reconnected. So I'm going to go ahead and publish this. Can you see it, Natasha? Yes, so we have 7 people from the public sector, we have 9 people in the private sector, and we have 8 people in the nonprofit world. So we have educators, we have people across every industry, and some people didn't answer, but that gives you kind of an idea of who we have in the room. So I'm gonna let Natasha introduce herself, but I will just say, I came from Pepperdine, and Natasha has a huge reputation at Pepperdine of just being an advocate, a justice leader, and she's just one of the favorites. Students love her, and I've had the opportunity to hear her speak many times. So I just want to give you the mic and thank you for being here to help equip us across the city of Long Beach.
Sure, I'm glad to be here. Thank you for the invitation, and hello to everybody who's here. Thank you for taking some time out of what I'm sure has been a busy week on a Friday afternoon. So I thought I'd start by telling you a little bit more about myself before we get into the presentation. As Carrie mentioned, I am a professor at Pepperdine. I am in the Graduate School of Education and Psychology, and I've been there for about 7 years. And so trained as a clinical psychologist, and before I started my academic job at Pepperdine, I worked as a clinician full-time in a few different settings, including public mental health, college counseling, and the hospital and correctional system. So I really love exploring connections between academia and practice. And so part of the motivation behind this talk is actually to bring together and bridge science and research and application. And another just thing about me, the last 3 years I've been serving as the director of our online psychology programs at Pepperdine. We have 3 master's programs that are entirely online. And so, you know, we've been doing the online thing for a little while, and it's been interesting to sort of see that expand in the context of COVID. So it's a little bit about me. This talk is, I'm gonna go ahead and share my screen so that you can see the PowerPoint slides. And this talk is really a adaptation of a talk that I gave in 2018. Give me just a moment. I'm organizing my windows here. So I gave this talk in 2018, and it was interesting as I was prepping. I was going through my slides, and I had so many moments of just recognizing the time and place that we're in right now is so different. And so it was actually a good exercise to have to think and update. Hence, I've titled it COVID-19 edition. And so I'm going to start by talking about just a couple definitions of what stress and resilience are, and then most of the presentation will focus on some concrete tools and frameworks to help you as individuals, leaders, and community members. So let's start with defining resilience. This is a helpful, I think, working definition from the American Psychological Association. And I want to highlight that the definition characterizes resilience as a process, not an outcome. So this definition says that resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats or significant sources of stress, such as family and relationship problems, serious health problems, or workplace and financial stressors. Another way of thinking about resilience is the ability to bounce back from adversity. Some other terms that are associated with resilience are post-traumatic growth and learned optimism. And thriving is also a word that is sometimes associated with resilience. For the purposes of the talk today, I think this APA definition is really helpful. And to get a sense of what everybody's sort of initial orientation towards resilience is, I'm going to ask Carrie to launch our first poll, which is going to pose a question just to get you thinking about how you think about resilience. So take about a minute and just a true false question. Carrie, I'll let you go ahead and close that poll when you can see that most of our participants have taken it. Okay, good. So I'm doing a little bit of preaching to the choir here. It looks like 97% of you agree that resilience can be learned. And so that's really the good news here, right? Is that there's some scientific research suggesting that there definitely are characteristics that make people more or less likely to be able to build resilience. And so certainly there are genetic, biological, personality factors. Early childhood environment, of course, has a lot to do with how our brains adapt and grow. But we also know that there are many people who seem to thrive in the context of really adverse and traumatic experiences. And so it's a very interesting question to think about what equips people to be more likely to learn resilience, perhaps more quickly. And so let's talk next about stress. These are the two constructs that we're going to be talking about. So we just talked about resilience. Now let's talk about a definition of stress. So very simply, stress is anything that places a demand upon a system. And so stress is neutral. It doesn't necessarily mean it's bad or a negative event. So there are plenty of happy events that happen that cause stress, right? So graduations, weddings, births, promotions, many of these things I think are conventionally categorized as wins or positive things, but they nonetheless can pose stress on a system. And so I think, we all accept stress as a part of normal life. Stress is, in fact, one of the only ways to grow. We can't really stretch ourselves if we're not exposed to stressors. And the Venn diagram that you see on this slide is a model that comes out of health psychology. It's called the biopsychosocial model. And it's a way of thinking about the three different ways that stress can be experienced and perceived. And so to give you an example, our individual response to stress can be influenced by a combination of biological, social, and psychological factors. So for instance, people who tend to have supportive interpersonal relationships are going to be more likely to respond to stress in a way that allows them to cope and build resilience. This model is also helpful in understanding the effects of stress. And so stress has effects that can be evident in our biological systems, in our psychological systems, and in our social systems or social relationships. And so this model is going to be something we carry through this talk, and it's also helpful for identifying pathways for intervention. So if I know, for instance, that building resilience includes building social relationships, I can sort of target a series of interventions through the social pathway. There are certain psychological traits that will increase resilience, and we'll talk more about those in a few minutes, but that also identifies another pathway through which I can build resilience. And so related to the point of stress being a normal part of human experience, this is a very helpful, I think, graph, it displays, the Yerkes-Dodson law. The source for this is Harvard Business Review. And it basically demonstrates that under normal circumstances, so, barring, a global pandemic, for example, under normal circumstances, generally there is what we call an optimal range of anxiety or an optimal range of stress. And that's evident by the peak of the green curve here. And so by arousal, that just means your body is sort of mobilizing its resources. And so at a moderate level of arousal, we are alert enough to respond to a situation. And that's when our performance tends to peak, because we're not disengaged or just, demotivated or hopeless on the bottom left sort of corner of the chart. And we're also not so activated that we're paralyzed or immobilized. And so this idea of finding the optimal range of stress, I think, is helpful, because we always want to keep in mind that stress can be useful. And indeed, stress actually is a gift, in a way that stress helps us survive potentially life-threatening situations. And so I'll come back to the previous slide in just a second, but if you look at this image, this is, one of the images that I sort of could come up with that demonstrates a life-threatening situation. You're out in the wild and a grizzly bear is about to attack you. Pretty scary. And in this situation, if you're not feeling stress, you're not going to survive. And if you are immobilized by your fear reaction, we're going to talk about fight or flight in a second, then you're also going to be hampered in your response. And so stress is the gift that helps us recognize danger and helps us mobilize resources. I'm going to go back to the previous slide and outline a couple different types of stress. So these categories can sometimes be helpful for you to think about and reflect on what is happening in my life right now, what kinds of stress am I experiencing right now. And so on the left column, acute stressors are time limited, they generally go away. Things like traffic, although that's not so much an issue these days with our lockdown situation. But you remember back in the good old days, maybe remember with almost nostalgia now that we're all homebound, you had a rough commute. That might increase your stress, but by the time you get home or by the time you get to work, it starts to dissipate. Acute stress can also be risk-taking. So a thrill ride at an amusement park, or pushing yourself in terms of like a physical goal. And so acute stress is the kind of stressor that's normal, that is supposed to kind of abate. And however, the accumulation of multiple acute stressors or a stressful situation that persists in the long term is what we would call chronic stress. And so chronic stress is what is the bad stress. Chronic stress can often lead to all kinds of negative biological, psychological, and social consequences. So there's tons of evidence in the research that stress in our bodies can produce toxic effects. It can lead to all kinds of problems such as heart disease, chronic pain, autoimmune disorders, sleep disorders, and an overall weakened immune response. Many of us you can reflect your own experience and identify experiences of both of these types of stress, acute and chronic stress. So I highlighted the grizzly bear as a life survival threat or a survival threat. In this situation, our stress response is a gift. This diagram shows you neurologically the two different ways that our nervous system can respond to stimuli. So on the left-hand side, and I'm looking over here to the right because I have my other monitor here where I can see the diagram. On the left-hand side, our parasympathetic nervous system is what's called the rest and digest system. So when this system is activated, our bodies are resting, recuperating, doing bodily repair at a biological cellular level. On the right-hand side is our sympathetic nervous system. This gets activated in fight or flight situations, or when you perceive a situation as life-threatening or scary. Keyword perceive, and we'll come back to that too. And so the fight or flight response is the body's gift to us that helps us survive. What happens in chronic stress situations is that fight or flight system is getting activated way more frequently than our bodies are equipped to handle. And so that's when you start to accumulate biological damage to your system and psychological damage to your system. Is that fight or flight system needs to be turned off so that the body can go back to rest and digest. And if the body cannot go back to rest and digest because it's constantly or chronically in fight or flight, that will take a toll. And that's where we start to see the longer term negative consequences of stress. And so I want to pose a question, and if we could go to poll question 3, actually. I skipped poll question 2. So poll question 3. I want you to think about your current situation, our current situation of COVID-19. What kinds of stress has COVID-19 presented for you? Take a few minutes to reflect on that and select the response that best captures your experience. Okay, so we have 15% acute, 9% chronic, 62% acute and chronic. So the majority of you are experiencing this as both acute and chronic, and 5 of you, 15%, are experiencing no stress. So I included that option intentionally because, the question we're going to go to next to start our conversation about resilience is, why doesn't everyone respond to stress in the same way? So even within this group, it looks like we had a range of responses. And so there are many reasons why people respond to stressors in different ways. Some examples within the biopsychosocial framework include genetic, predispositions. There's something in psychology research called trait optimism. This is basically what appears to be somewhat of a stable personality factor where some individuals happen to be more likely to take an optimistic perspective on events than others. Other variables that affect our response to stress include available coping skills and resources. What do we have at our disposal? Social support, context, that kind of captures all kinds of influences. And perception is a really important piece of this. And so how we perceive and appraise a situation has a direct influence on our bodily, psychological, physical, emotional response to it. And so one of the findings that has come out of the research on resilience is that, there's lots of different theories about resilience. And I'm guessing some of you are mental health professionals or have had some exposure to psychology. You may have noticed psychologists love coming up with different theories to explain the same thing. And so, there's lots of words thrown around that at some level essentially mean the same thing. So, there was a researcher, Diane Kutu, who has done a lot of work on resilience, and she reviewed some of the prevailing theories about how we understand resilience. And in her review, she identified 3 key features that emerged across all the different definitions and theories of resilience. So she kind of consolidated the different theories and extracted the main themes. And so there are 3 here. We're going to keep coming back to these over the course of the next portion of the presentation. So number 1 characteristic of resilient people is that they face reality head on. They look straight at it. They aren't in denial about it. And that enables them to fully assess the threat or the stressor and then mobilize a response accordingly. So that's number 1. Number 2, they make meaning out of difficult and even hopeless situations. I'm going to give you an example of this as we move through the presentation, so we'll come back to that. And then number 3 is they improvise. So another way of thinking about improvisation is adapting, being agile, being flexible. And so as we agreed at the beginning, resilience is something that can be learned. And I think that these 3 characteristics offer us some concrete pathways by which we can practice the skills that will enable us to increase our resilience. Before I go into the next portion of the presentation, I wanted to pause here and see if there are any questions so far. If there's anything I can elaborate on or explain further before we kind of head into more of the application focused portion of the talk. So you can go ahead and type your questions into the Q&A pod or into the chat box. I'll be able to field them during this brief break. Okay, I see one question from Alexis asking about my dissertation topic. Thank you for asking. I don't get asked that very much anymore. My dissertation was looking at stigma related to mental health services and cultural factors that might influence that. I'm not seeing any other questions, so I'll go ahead and move forward and go ahead and type them in the chat box. We'll come back to them. We'll have multiple opportunities to come back to them. So I'm going to introduce a model for kind of how we're going to structure the next portion where I talk about concrete strategies and questions that you can ask yourself to enhance your resilience in a multitude of situations. So this is a model, a model that I think is helpful to just organize the information. And we're going to go through each of the 5 components of the model one at a time, starting with assess, which is the first step. And as we move through the model, you'll know because the box that we're focusing on will be highlighted in this pinkish color. And so if you remember a few minutes ago, I mentioned that perception of a stressor or appraisal of a stressor is very important and influential in determining how we react. And so when you're confronted with a situation, your first step is, whether you're aware of it or not, your brain is assessing the situation. Your brain is processing, what am I seeing, what am I encountering, and what does this mean? Now, our brains have the amazing ability to create shortcuts for how we appraise and assess situations. So to give you an example, our brains learn very quickly what the cues are that tell us if situations are safe or unsafe. So consider walking down the street and during the daytime versus in the dark. Our brains have learned instinctively that we need to perhaps be more vigilant in the dark. And so that is an unconscious process, and that prevents us humans from having to reassess every single day what's a safe situation and what's an unsafe situation. So our brains learn these things so that it frees up the other resources in our brain to focus on other things in life. So this is an amazing skill, but what also happens is sometimes we learn bad habits or we learn inaccurate perceptions. And so one of the things that we can do to build our resilience and to confront stressors is to actually bring our assessment into a more conscious realm. And so here are some questions that will help you when you're confronting any situation to pause and take stock before you engage in a response. And so this is also where mindfulness can be very helpful. So mindfulness is in and of itself a topic that is worth lots of deep exploration, but the basic concept of mindfulness is the skill within which we can be observant and aware of what's happening internally and externally. And to be mindful is to focus your attention intentionally, to prevent responding to things from a reactive perspective. And so particularly if you're being confronted with multiple stressors, that cognitive load can add up really quickly. And so pausing and taking a deep breath and assessing what is actually happening can sometimes help you separate the wheat from the chaff in whatever situation you're trying to navigate. So some of the questions that will help you with this is to ask yourself, what feelings am I having? What thoughts am I having? What physical sensations am I feeling in my body? And what happens when we do that neurologically, this is really amazing. Neurologically, there's research now that shows when we pause to actually describe the thoughts and feelings that we're having, our brain activity moves from the emotional center. I'm sort of putting my hand here because it's kind of in that portion of your brain, your amygdala. Our neural activity moves from our amygdala, which is where the fear response lives, into the prefrontal cortex, which is where our processing, analysis, planning, and strategizing lives. And so the knee-jerk reaction to the grizzly bear barreling down at you is coming from that amygdala emotion center of your brain, as it should. But if you're sitting in your office and you have, 100 emails that you haven't gotten through, and you're looking at that number, your brain is still processing that from an emotional space until and unless you're able to move that neural activity to the prefrontal cortex. And the way that you do that is to try to practice mindfulness and pausing and assessing what is actually happening here, right? And so we want to try to make sure that that survival response is only really triggered when it is a life or death situation, which the 100 emails, it may feel that way, but it's not in most cases. And so these are some questions that you can ask. Another potential question that might help you is that sometimes, particularly in a situation like this, the COVID-19 situation, there are legitimate threats, and we are facing a potentially life-threatening threat. And so I don't want to minimize that. But what can happen is our bodies, like I said, our stress response, if it's chronically activated, it might be excessively activated. And there may be ways that we can tone it down by just pausing and figuring out and assessing what it is that we're dealing with. So this is related to that characteristic number 1 of resilient people, that we face reality head on. And you may find that after practicing mindfulness, things are actually as bad as you thought they were. And that's not a good or a bad outcome. That's just the realistic outcome. And to acknowledge the reality is necessary for you to then determine how to mobilize your response. And so I want to make sure that we're also clear that this assessment process is ideally a judgment-free process. The goal is not to sugarcoat things, and the goal is not to always be catastrophizing. The goal is to try to figure out realistically what is actually happening and what am I facing, so that I can mobilize an appropriate response. So once we've assessed a stressor or a set of stressors, one of our options is to alter the stressor itself. Now, this isn't always possible, but sometimes it is. And so some of the questions that you might ask to figure out if you can actually alter the situation is, can I change the stressor, right? So I'll give you an example. It feels quaint in the context of what we're dealing with, but let's say you have a doctor's appointment every month and it's in a part of the city where parking is notoriously difficult, and you're, heading over there after a long day at work on the way to picking up your kids from school, and to spend 10 or 15 minutes finding parking is just sometimes more than you can handle. Well, pay for parking if that's an option, right? Find a way to take public transportation. See if you can eliminate that stressor. Like I said, that's a bit of a quaint example, but there are sometimes things, even now, where we can change the stressor. We can alter it. Sometimes we can exit a stressful situation. We can decide, I do not need to expose myself to this stressor right now. Sometimes we can eliminate the stressor entirely. And so, like I said, you can't always do this, but you won't even know whether these are your options if you haven't first paused to figure out what it is that you're dealing with, right? So you assess, and then you see, can I alter it? And one tip here to build resilience is to think about where you can exercise healthy control. So a lot of times stress is stressful because we feel that it's unmanageable, or we feel that it's out of our control. And sometimes that's very true. We'll talk about that in a few minutes, how that's very true right now. We can't control this virus, right? For instance. But it is always helpful to think about things that you can exercise healthy control over, even in the midst of a situation that in which you don't have a lot of control. So thinking about what can I do is often a helpful starting point. Next, adapt. And let me also say that in the diagram, the arrows only go from assess to each of the 4 strategies, but these can overlap. And when it comes to resilience, you want to use any tool in your toolkit in whatever way is going to be helpful. So these aren't mutually exclusive by any means. So adaptation. What does that look like? Sometimes we can't change a stressor, right? We can't control it. And so one of the options that is available to us is to adapt to it. And so what do I mean by adaptation? Adaptation can occur from a sort of, if we think about a biological system or even think about an ecological system, adaptation is growth, right? It's a form of growth. And there are ways that we can intentionally exercise that at multiple levels. So one is to ask ourselves, is there a different way that I can think about this situation that will help me mobilize a response? And so what happens in stressful situations is, like I said, your brain starts processing from your fear emotional center. And what happens when your neural activity is coming from your emotional part of your brain is that you're no longer able to think and analyze as clearly or quickly as you normally would. This is why if you're in a stressful situation like public speaking, well, I'm talking to a group of leaders, so maybe most of you are not, this is not one of your top 5 fears, but think about one of your top 5 fears, and you can probably resonate with the experience of feeling frozen or feeling like drawing a blank. That's because your brain's processing, your information processing is on pause because your amygdala and your emotions need to deal with this perceived threat. And so one thing that you can do is you can actually intentionally build your brain's ability to switch from that emotional place to a more prefrontal processing, evaluation, strategizing place. And so let's go ahead and do our next poll question. This will kind of get us started in this conversation about cognitive flexibility. So Carrie, I'll let you close the poll when we have enough responses here. Okay, so looks like about half of you said the brain stops growing around age 20 or 30, and the rest of you 40 or 50. So the good news is actually it can grow well into your 50s and 60s. And so the old wisdom used to be, well, once you're through your 20s, your brain's done growing and it's all downhill from there. So we actually now know that's not true, and that there are ways you can exercise your brain to keep your neurons building connections. It's called neurogenesis is the process by which our brains build new neural connections, and neuroplasticity is the process by which our neurons become more flexible and adaptive. And so there are some things that you can do here. You can figure out if you are engaging in rigid thinking and try to seek out different ways of seeing a situation. You can ask yourself if you need help with adapting to a stressor. So reaching out and getting perspective with somebody else. Under normal circumstances, when we're not all trying to mobilize in response to a crisis like we are now, even small things like puzzles or problem solving or seeing things as a challenge can actually shift your brain from a more automatic response to an intentional problem solving response. So you really have to look for the opportunities to grow here. But there are a couple ways that you can recognize if you're engaging in rigid thinking. And if you are, then that's time to pause and to ask yourself, what am I missing here? Is there another way of seeing the situation? One of the quotes I'll share with you that I love is a quote that says, "Smart people have trouble learning because it involves so much floundering and failure." And learning is indeed difficult and challenging, but situations that are unprecedented, like the situation we're facing now, calls for improvisation and creativity. And we see a lot of that happening, right? We see people, all kinds of people putting out tutorials for how to improvise to make homemade masks. We see ways of repurposing resources and being creative and doing what we can to respond to a situation that is unprecedented and unexpected. And so this flexibility, this agility piece, granted right now in COVID-19, we don't have the luxury of maybe doing crossword puzzles to build those new neural, connections, but that doesn't mean that there aren't other ways that we can practice flexibility and getting perspective. And so if you're finding yourself stuck in a rut, unable to dislodge from that, maybe you need to call a colleague in a different industry, in a different sector, who does different work, and brainstorm and work together and see if you're missing something and if there's an opportunity to, again, be creative and improvise. I want to pause and just acknowledge, I see that there's all kinds of activity going on in the chat. Carrie, did you want to just address what's happening in the chat box here before we move forward?
Yes, I really want to apologize for someone, looks like someone joined our meeting. So in the future, we will have it where you can only join if you have RSVP'd and have a password. But also, we're trying to Google how to clear the chat box because those are very disturbing messages, and I apologize, we can't clear the chat box. But please just send any questions directly to the Q&A box, and we're going to try to make it so yeah, I just deeply apologize. I know those messages are extremely disturbing and traumatic to read, and so I want to make sure you know those were not endorsed by anybody from Leadership Long Beach or from Dr. Natasha.
Thank you, Carrie. We have to another opportunity to practice pausing and responding and kind of being agile and nimble. So I appreciate, Carrie, you jumping in and that you're working to try to limit our exposure to these unfortunate comments here.
I have a few questions that have come in the Q&A box, which you can at the end or now, whichever.
I'll go ahead and take them now. Thank you. These are good questions. So there's a question about whether this is taking into account COVID-19, and a participant is feeling like we're in a different situation now, and that some of what I've been talking about is pertinent to daily life. And I do appreciate that question. And I think I certainly don't want to minimize or invalidate the reality that I'm sure some or many of you are facing in your roles as leaders. And so, the next couple slides are going to talk a little bit more about meaning and values and situations where we really can't exert control over a stressor. And we'll certainly have some time for discussion where I'd be happy to respond to the questions that maybe are most relevant to what you're dealing with right now. Some ways that I personally fend off stressors, yoga or meditation. Yeah, definitely. So there's a lot of different ways that I've tried to adapt, for instance, to the current situation. Now, fortunately, I am able to work from home. And that as a result of that, I haven't had much disruption yet to my finances or ability to get things that I need. But I have been taking more walks. I have been stepping away from my computer. I have pretty strict boundaries around where I work in my house. I only work in this one place. And I am actually taking more breaks during the day. So which I can't do when I'm at the office. So I'll take a half hour or an hour break once or twice a day to break things up in the middle of my work day, because I need that space for my brain to reset. I can't function well if I'm just constantly one fire after another. And on days where I have to put out one fire after another, I try to get some extra sleep. I try to take the morning off the next day if I can. I do work out. I've been exercising from home, eating healthy, sleeping, connecting with loved ones over the phone, over Zoom. So really all kinds of things at my disposal that I've been trying to employ. I have another question here about students adapting to the current situation. So great question. I mean, to give you an example, you know, the programs that I direct, we have students who are out in the field accruing hours towards licensure. And as a result of the pandemic, we made the decision to pull all of our clinical training students from their sites. And what that has resulted in is, for some students, it is going to inevitably extend their timeline to graduation. And that obviously could potentially have financial or life consequences for them. And so one of the things that we've been doing first and foremost is to be very transparent with our students. And so, you know, I and some of my associate directors have written you know, multiple emails to try to explain the situation. We've invited feedback. We have, before making a decision across the board, we have done our best to try to get stakeholder input. You know, we have been honest about our limitations. And I think that has really helped our students recognize that, you know, we're all just trying to do our best here. And we don't all have the answers, but we can be considerate and extend compassion and grace to one another in the process and work together to arrive at what is possibly the best solution available. So for instance, we've been mobilizing to try to relocate some of our students in different sites to try to help them. We've waived various finance charges when we can to alleviate some of those burdens. And we've also, like I said, I think, tried to acknowledge directly to our students that we're doing our best, and this is not great. And for some of us, and for many of them, it's been quite horrible. So, you know, I don't have any platitudes or anything to neutralize the reality of how stressful this is. But I think that part of that is to acknowledge that this is the reality. And I think that has been helpful for some of our students. So we have one more strategy here to talk through, and then I'll be happy to take more questions towards the end. So talked about adaptation. Two more strategies: acceptance. So these two are the tough ones, and these two are the ones that I have found myself practicing more and more in our current crisis. So let me be clear and define acceptance. Accepting a stressor does not mean I approve of it, or that I welcome it, or that I'm happy about it, or that I like it, or that I asked for it, or that it is my fault. Acceptance is a deeper layer of facing reality. And acceptance is to recognize that this is what is happening. And if we can't control a stressor, if we can't change a stressor, as you know, that doesn't mean it disappears. And so sometimes what we have to do is accept that it is happening and try to see if we're in denial. And if we are, to try to get out of it so that we can face head on what's actually going on. And like I said, mobilize accordingly. So I'm going to read you an anecdote about acceptance in action. This is from the Harvard Business Review's 10 Best Reads on Emotional Intelligence. And it tells an anecdote of an Admiral, Jim Stockdale, who survived being held prisoner and tortured by the Viet Cong. And he survived in part, this is based on his own recounting, he survived in part by accepting that he could be held for a long time. And indeed, he was held for 8 years. Some of his comrades who did not make it out of the camps kept optimistically assuming that they would be released on shorter timetables, by Christmas, by Easter, by the 4th of July. And in reflecting on this experience in an interview with Jim Collins, who wrote Good to Great, he said, "I think they all died of broken hearts." And he attributed part of his ability to survive to accepting that the situation could last much, much longer than they had hoped and expected. And so this, I think, is heartening, actually, because it opens to accept the reality of a situation is to open up options that would not otherwise be available to you. So for instance, when we first went on lockdown, I forget what, I live in the city of Los Angeles. And so, the mayor's office, I think initially said it was going to be 2 weeks, and LAUSD still hadn't decided when they were going to open up classes. And it was really easy, and we were all hoping we'd be back in action in 2 weeks. And then it got extended. And then all of our classes started going online. And I think at this point, one thing that I take from this anecdote is this could last much longer than any of us thought. And if I'm willing to accept that this could last, let's say through the end of 2020, that we will all be working remotely and social distancing till the end of 2020, what am I going to need to do to mobilize for that? What am I going to need to think about? And so, it's not catastrophizing. It's just accepting that this could be very, very bad for a longer period of time than we initially thought. And what options does that make available to me in how I respond to this or how I prepare for this? It's almost practicing survival before you have to employ it. Obviously, right now we're having to practice, employ, and implement all at once. But again, acceptance is not approval or inviting. It is simply facing reality head on at a deeper level. And the last strategy that we'll talk about is called appreciating stressors. And this is where I will share with you the anecdote of Viktor Frankl, who was a neurologist and is best known for his book called Man's Search for Meaning. And Viktor Frankl was a prisoner during the Holocaust and Auschwitz. And he talks about how in that period of time during his imprisonment, he had to, one of the ways that he was able to survive and keep going was to think about what meaning could be derived from the situation. And one of the examples that he uses is that he imagined while in his imprisonment, while not knowing if he was going to live or survive it, he would imagine surviving it and at some point in the future delivering a talk or a presentation about what the experience was like so that others could learn from what he had gone through. And so that example is one, and take it from the expert of meaning making, right? An example of how even in hopeless and seemingly interminable situations, the capacity of the human mind to consider purpose or meaning can actually build our resilience. And I want to be clear that I'm not talking about sugarcoating, and I'm not talking about Pollyanna, superficial thinking, everything works out for a reason, or, fill in whatever trope it is that comes to mind. I'm talking about real, genuine, and authentic searching for meaning and purpose. And this is where I want to encourage you to call to mind your deepest values and your most sacred beliefs about humanity, about spirituality, about faith, about values, and really dig deep and authentically see, is there any meaning or purpose that can be found in this? And so this is, this I think is the hardest, or at least I'll just speak for myself personally. This is the most challenging approach for me to take. And sometimes it can feel like an empty exercise, which is why I think it's really important for this to be an authentic process. And there are plenty of, I think Viktor Frankl is one, but think of other leaders who have survived, traumatic and hopeless situations. Think of Nelson Mandela. Think of, whoever comes to mind, these visionaries, these people who we can look up to and learn from. So this is the time for us to dig deep and really identify and clarify what our values are. And we don't do that alone. We really need to remember to rely on our community as well. This whole talk, much of this has been at the level of the individual, things that you as an individual person can do. Many of them apply to groups and organizations as well. Organizations can learn to be more flexible. Organizations can learn to be creative and to improvise. Families, couples, friends, groups. And so, you know, don't forget that there's a whole nother layer when we remember that we are all in this together, and that we need to connect, and we need to come together and learn from each other. So I'm gonna pause here. I have a couple links on the screen. I'd be happy to share these over email, but these are just a couple articles I selected that are more timely and related to the situation now. So the first one is the resilience article from the APA. It's just very practical, review some of what I've talked about. Mental toughness is another, you know, construct that's related to this. And this, I thought, it's an older article from the BBC, but I think is helpful and includes a lot of helpful hyperlinks. And then the last one, the NIH actually has a whole page on stressors related to coronavirus. It has information about contagion and sanitizing and symptoms and some very concrete stuff that we really didn't have time to get into, but that is a helpful, and they're constantly updating it. I think it's a helpful resource. So I'm going to open the Q&A pod here and respond to some of the questions that have come in, and then I'll be happy to take any other questions. So there's a question here about someone is talking about doing okay so far, sleeping well, which is great, but they're worried that they might suffer some stress response that they don't see coming. Yeah, I know, I hear you, me too. So, you know, I always go back to reminding myself, you know, of what I can control and what I can't control. I think maintaining healthy practices is going to buffer your response to any unforeseen stressors that are going to come and hit you. Remember, we want to try to activate that rest and digest portion of our system. And so even like a 10-minute mindfulness on a daily basis can be helpful to shift your brain's resources back to restoration. And so you want to try to kind of get to a place where you're able to have enough resources, as many resources internally as possible, so that you're prepared for whatever demand might present itself. And so I think combining some of the strategies that we've talked about will help with that. Another participant has shared that they work with new parents, especially mothers who are not only stressed, but need to assess, adapt, accept, and appreciate while taking care of their kids. Any insight that I can deliver? Well, you know, I think that obviously not knowing the specifics of these situations, maybe taking one of these steps at a time. So, you know, it's kind of a lot to do, assess, alter, adapt, accept, appreciate, you know, so I think really kind of helping people recognize what they have the fastest access to and really practicing that skill. I think the good news is kids are incredibly resilient. And sometimes, you know, we need to remember the oxygen mask principle, where you know, if your plane is going down, you need to put your oxygen mask on first before you put it on your child. And so similarly, you know, what does this mother need to bring herself to a place where she can then turn and put the oxygen mask on? So sometimes that can't be done individually. Sometimes that has to be done collectively. And, you know, I think there are also programs that exist that can give mothers respites. So one, for instance, is called Safe Families. It's administered by Olive Crest, and it's a program where mothers can seek support from approved host families who are willing to pitch in and help with childcare, especially considering the circumstances. So I'd be happy to follow up with you about that program as well. There are some resources in the community. Somebody asked about the book I was referencing with the veterans. So that the anecdote that I quoted was from the Harvard Business Review 10 Best Reads on Emotional Intelligence. But the interview with that admiral can also be found in Good to Great, which is a book by Jim Collins, which talks about how organizations can go from good to great. It looks like that's the That's the only question here. I have another question. I'm one of those people who manages stress through hard physical exercise. It's been tough, unable to rollerblade, and walking hasn't helped much. Other options to make stress feeling drained from my body. Wow. Yeah, me too. So I don't know what your home situation is in terms of internet or devices, but there are, a lot of gyms have made their classes available at no cost. Nike Training Club is an app that you can download, and they have, I think, have made their premium workouts available at no cost as well during the COVID situation. There's plenty of YouTube resources for exercise, and so I would encourage you to these are great examples of people being adaptive and creative in the context. And so maybe a Google search or a YouTube search, there's a ton of free exercise resources available that you can follow along with video. That's what I've been doing. And so I think that, one of the classes that I did recently, if you don't have weights at home, you can use canned food. My husband was doing something out there with a bag of his toolbox. He was using this toolbox like it was weights. So, I think that really kind of doing what you can, even within the confines of your house, as much as possible. And then, of course, as soon as the rain clears, hopefully that will help you get back outside where you work out best.
Awesome. Well, thank you so much, Natasha. This was really good to hear from you and just to understand more like what's happening in our bodies as a result of stress, because I think all of us are experiencing it in some form, except for those 5 people who are not experiencing stress, which is pretty amazing. So they probably are doing some of the things that you're talking about to manage stress. So thank you so much for being here.
Sure.
We survived our first Zoom bomber. You handled that so well. And I just realized that the messages were only coming to the panelists. So that's the good news, is that not everybody was affected by those. But it's a good reminder for us to keep ourselves protected. And yeah, great job on handling that stress in the middle of your presentation and continuing to deliver some great content. So I just want to remind everybody, we do these every Friday through this time. And next Friday, we are going to have Dr. Lisa Perrine joining us. She is the CEO of Cibola Systems, but she has some content on using design thinking to help philanthropy. So I know a lot of nonprofits are being hit right now. A lot of our fundraisers have been canceled. So this would be perfect for you to invite any of your friends who run nonprofits or even business sectors to be able to use design thinking as we regroup and try to use this time to think through what are we going to do for future planning. So please join us next week. But in the meantime, thank you so much, Natasha. You did a wonderful job. And I think if you guys want to give her any information or shout out, go ahead and respond in the chat box with any information you have for Natasha. But looks like we have one maybe raised hand. Not sure if there's one more. Yeah, just saying thank you. Great topic. So I think everyone it was very timely to have this information. And we're grateful for you. Thank you so much. Keep up the good work and keep sharing this right now. Everybody needs to hear this.
Thank you for the invitation. I enjoyed it. Have a good weekend, everybody.
Great. Have a good day. Bye, everyone.
Bye.
I'm so glad those messages didn't get sent out to everyone.
Oh, my goodness.
Wow. Well, have a good day, Natasha.
Thanks. Bye, Carrie. Take care.
Bye. Let me. Hi, Satya. You can talk now.
Okay, thank you.
How are you?
So during this break, I have been working on a nonprofit organization I named Support for Seniors, and the goal is to provide communication to those inside of nursing homes because it's very difficult for people to go in and out of nursing homes right now, because if someone accidentally brings the coronavirus in, it would be really detrimental to, because the patients at these nursing homes, if they get sick, it would be really bad. So I'm writing letters, and I was wondering if we could add that to the how we're writing letters to the first responders for the coronavirus.
Yes.
So I was wondering if we could incorporate that into it, and we would be writing to the people working at the nursing homes. And just because a lot of them, they aren't even leaving the nursing homes, and they're actually sleeping at the nursing homes.
Wow, I love that idea. Yes, for sure. So we are not meeting tomorrow with the class, with the youth class, but we are meeting next Saturday. But if you, I will send an email out to the letter writing group today, and I'll include you, and we'll try to get a meeting together sometime this week. But that's a great idea. We'll add that to the list. So the class is willing to write letters. We just need to figure out who to write them to, and get them the contact. So it's either we need to give them an address to send a hard copy letter to, or give them email addresses so they can send those letters. But I love that idea. Yes.
And you could even, they could even send it to my address, because what's going to happen is the letters are going to be held for 2 weeks before they're distributed to the nursing homes, because just to make sure that there's no trace of the coronavirus on the paper.
Awesome. I love that you already did that kind of homework to make sure you can deliver letters in a way that's safe. That's awesome.
Thank you.
If anyone else is hearing this, I just want you to know Satya is in the Youth Leadership Long Beach class of 2020. What school are you at?
I'm at Wilson High School.
And what year are you in school?
I am a junior.
Okay. So you're a junior, and we're so glad to have you in our program. And so the class of 2020, you guys have been deciding how are you going to do a class project now that you can't meet in person. And it's great that you guys have so many great ideas for how to do your project virtually. So I will send out an email today and make sure we get we'll just do an online Zoom meeting with your committee. And this is, we'll add this to the list. I think it's brilliant.
Okay, great. And I'm wondering, because I have other kids that are not in Leadership Long Beach that say that they're willing to help out. So how are you collecting the letters?
So let's talk to your committee about that, because Jeremy actually wrote me and said that some of the ASBs at the different schools want to help too. So your committee doesn't need to write the letters, but you guys just need to come up with strategy. And once you know how to write, like it sounds like you already have the strategy that you've been researching. So
I've been working on this for a while.
Yeah, that's perfect, because we need the strategy, and then we can reach out to the class will help write letters, but then it sounds like the ASBs at the different schools will also help. And if you want to be the point person where the letters come to, I think that's perfect. So yeah, let's talk about that with the rest of your group. It's Gabe, Jeremy, Dylan, Mia.
Yeah, Jeremy was talking to me about it, because we were thinking that this would be a good idea.
Good. I'm glad you're already in touch with them.
Especially because I have the connections. I'm working with someone she's actually in charge of the health facilities of over 1,000 nursing homes across California. So she wants to make this happen.
Awesome. That's so awesome. I love it. It's going to be so meaningful. Thank you.
Thank you.
Okay. Well, look for an email from me later today. I'll email your whole committee.
Yeah, of course. Okay. Thank you.
All right. Have a good day.
Have a nice day, Miss Isna.
You too. Bye.